Hi guys, welcome back to MHP Mental Health Piece. If you haven't subscribed to us yet, please subscribe. So today we will be talking about selective mutism, which is the next part of neurotic disorders and the second anxiety disorder under the DSM-5. Selective mutism is a rare multidimensional childhood disorder that typically affects children entering school age. It is characterized by the persistent failure to speak in select social settings despite possessing the ability to speak and speak comfortably in more familiar settings. People with selective mutism often experience intense fear or anxiety in social situations where speaking is expected, such as school, parties, or social gatherings. This fear can be so overwhelming that it prevents them from speaking, even though they may want to. Selective mutism can present a variety of comorbidities, including enuresis, encopresis, obsessive-compulsive disorder, depression, premorbid speech and language abnormalities, developmental delay, and asparagus disorders. The specific manifestations and severity of these comorbidities vary based on the individual. Given the multidimensional manifestations of selective mutism, treatment options are similarly diverse. They include individual behavioral therapy, family therapy, and psychotherapy with antidepressants and anti-anxiety medications. While studies have helped to elucidate the phenomenology of selective mutism, limitations and gaps in the knowledge still persist. The DSM says selective mutism is a rare childhood disorder characterized by the persistent failure to speak in specific contexts where speech is typically expected despite hearing and speaking in other contexts. The DSM criteria for selective mutism include: first, consistent failure to speak in specific social situations in which there is an expectation for speaking, despite speaking in other situations. For example, a child who speaks at home with close family members but refuses to speak to anyone outside the immediate family, including peers and teachers at school. Second, the disturbance interferes with educational or occupational achievement or with social communication. For example, a child who is unable to participate in classroom activities, make friends, or communicate with others due to their inability to speak in certain situations. Third, the duration of disturbance is at least 1 month, which is not limited to the first month of the school. For example, a child who has been consistently unable to speak in school for several months or more, despite the ongoing efforts to encourage them to do so. Fourth, the failure to speak is not due to a lack of knowledge of or comfort with the spoken language. Example, a child who is fluent in the spoken language at home and in situations where they feel comfortable but become selectively mute in certain social situations. Fifth, the disturbance is not better explained by any other disorder. So for example, a child who is not experiencing any communication disorder like stuttering or a pervasive developmental disorder or schizophrenia or any other psychotic disorder but is selectively mute in certain social situations, that child could be experiencing selective mutism. It is important to note that selective mutism can be a very distressing experience for those who have it and may require professional help. If you know someone who is experiencing symptoms of selective mutism, it is important to seek the help of a mental health professional for a proper evaluation and treatment. Apart from the therapies we have already mentioned, other therapies like cognitive behavioral therapy and exposure therapy can also help in treating selective mutism. In addition to therapy, there are several tips that people with selective mutism can use to cope with their condition. For example, practicing relaxation techniques such as deep breathing and progressive muscle relaxation can help reduce anxiety. Building up social skills gradually, such as starting with small interactions, can also help increase confidence and reduce anxiety. Well, that's all for today's video on selective mutism. We hope this video has helped you understand the condition better and provided some tips on how to cope with it. If you or someone you know is experiencing symptoms of selective mutism, we encourage you to seek the help of a mental health professional. Do not hesitate to reach out for support. Thanks for watching. See you next time.
If you liked our content, like, share, subscribe, and press the bell icon to never miss an update from MHP.